Lisa and I have been friends for many years. Recently, we had a difference of opinion. She went on a hike with, I'm not sure the exact number, but I think there were at least 12 people. None of them related that I know of, but 12 people went on a hike, and they were all unmasked and they were together for an extended period of time. The following is our conversation about that. The conversation continued through Facebook, so at points it may seem disjointed, but here it is nonetheless. 3 days ago, she said, when happiness is your priority, you keep it rolling. Great 6-mile hike with the crew from Gombe. What dope group of folks, finishing up with campfires, spiked hot cider s'mores, and general shenanigans into the night. I said, that looks like fun, but it also looks premature. We are in the midst of a pandemic with over 300,000 people having died in this country, disproportionately black and brown. While we are all wary and may not all have the risks, we all should model appropriate behavior for the greater good. I apologize if I have offended anyone, but I will risk it. This is none of my business, but you put it on social media, so I felt as though I should respond. Peace. She said, I hear you, sis, and why I have been more than paranoid about, I have been comfortable being outside with people, especially those I know. I have participated in group bike rides and outdoor hikes, limited indoor activities, mainly the occasional restaurant with the family. I haven't traveled since March, but I am rethinking how I'm going to move forward with life in the midst of all this. Definitely not offended by your concern because I know it's all love. People have to adjust to their personal risk level. I know for me, if I hadn't retired, I'd be putting my life on the line every day, going into the hospital, and for what? So no, I'm going to live outdoors. One day ago, she says, how do you navigate COVID-19? How do you balance physical safety and mental health? How do you model responsibilities and joy? One of my good friends questioned my judgment in sharing these photos, and I gave it a lot of thought. Things you should know if you care. Masks were initially, but to be honest with you, after a 7-mile force-paced hike, I felt entirely comfortable with everyone around me was COVID-free. If you could do that pace and gain that elevation, you were in no way physically compromised. Second, it's a known fact that outdoor activities are safer than indoor. Third, is anything 100% safe? No. Only you can decide for yourself how to vet your experiences and the people around you. Somehow, we have to move forward. I said, oh wow, so much to say. 320,000 dead from COVID in the U.S. That's more than twice the number that voted in the last presidential election. After 10 months, it's worse as ever, and we're all tired of it. Consider, there are asymptomatic carriers, there is a latency period. The greater the number of people, the greater the risk of exposure. Assessing someone's respiratory capacity after the fact may be too late, and if it was that obvious, we would know who to avoid. Granted, the exposure risk is not the same for everyone, and sometimes you model the appropriate behavior for the greater societal good. In my mind, that's the quickest way to get back to normal, back to fun. She said, I hear you. Hope you hear me. Some of this is not fun, but simply mental survival. Going up and down in the elevator in my condo or going to the grocery store in DC. I have more in close exposure to people than I did on that hike or a couple of hours outdoors around a campfire. Cumulative exposure to multiple people, just living day to day. I may try to stand 6 feet from people, but they don't necessarily stand 6 feet from me. People have been on airplanes for hours with the joke of having the middle seat empty, or usually not. We give up what we can give up until we can give more. You know, I'm aware of the medical facts as well as you. This is indeed a numbers game. 99% of my activities are solo. I am not going to apologize for the 1% that is not. She continues, answer me this. If you're still seeing patients that are not emergent, how many exposures a day are you having? It's impossible to do an exam from 6 feet away. If you're like most patients, you're seeing anywhere from 15 to 30 patients a day. Are they absolutely necessary? And if not, why are you risking the exposure? The friends, physicians that just had closed their office because staff testing positive for COVID, how many non-emergency patients did they expose? I said, risk magnifies with increasing exposure, which is the reason to limit when possible. Why increase the possibility of exposure if you don't have to? She said, then maybe you should shut down your practice except for only emergency patients. What is optional for some is a necessity to others. She said, no social distancing in that OR. LOL. I said, no social distancing in the OR? Really? As you know, they're wearing N95 masks and face shields for hours at a time. And this is comparable to hiking? And she said, you know I'm joking, be easy. Nevertheless, before I left work, 3 of the OR techs either had COVID-19 or have been exposed to COVID. You and I both know that even though people are wearing masks and PPE in the actual or between cases in the halls and etc. throughout the hospital, social distancing is laughable at best. Staff group around the OR scheduling desk is more exposure than an open air hike. Sorry, not sorry. And she said, like I said, add up your exposure in the office. And I said, the point is, it's not funny. Frontline workers have to work to feed their families, and there are risks. The question is, why risk undue exposure if you don't have to? And she said, I hear you, but you don't hear me. People are risking exposure to go to TJ Maxx and buy Christmas presents. People are wandering the aisles of Walmart getting cranberry sauce. The world is trying to function because functioning means more than doing the bare minimum. And for me, outdoor hiking is that thing. She said, and let's be perfectly honest, the hospital is risking frontline workers because elective surgery makes money. She said, it's a hot topic for sure, and I don't believe there are any easy answers. If you allow consumerism as necessary, I think outdoor activities for those of us who believe that mental relief are necessary. Personally, I don't need to buy anything except for toilet paper and bare necessities, so I am not in and out of stores. But plenty of people are, and I can guarantee that most of them don't need to be doing what they're doing. The worldwide Black Lives Matter protests where they unnecessary. Maintaining your mental stability and peace over this entire stressful year, I submit, is necessary. Is a necessity. She said, you still in the midst of healthcare work, and I get your concern. We probably won't ever agree on this, so peace out, and I love you. So take care of yourself, and I'll take care of me and those around me. And I said, no one ever questioned being outdoors for one's emotional, mental health, and we can agree that the risk abounds hospitals, stores, offices. The initial concern had to do with the number of unmasked persons who were in close contact with each other for an extended time. You stated that you were all masked in the beginning, which implies a certain sensitivity regarding potential exposure that got disregarded along the hike. I was unable to respond earlier and there is no need for you to try to explain anything any further. Hopefully, persons reading this will be thoughtful about their actions as we work our way through this pandemic. Peace.